Hello everyone, this is Emily speaking. Welcome to Crash Course Medicine. Today we're going to be talking about the menopause. So let's begin with some questions just to see where our knowledge base is at. Question 1. During the perimenopause, the levels of luteinizing hormone do what? A. Rise, B. Fall, or C. Stay the same? Think about the levels of all of the hormones before, during, and after the menopause. The answer is A. They rise. Question 2. What age is the average menopausal age for women? Is it A. 48, B. 52, C. 49, or D. 51? When do most women start the menopause? The answer is D. 51. Question 3. What treatment would you give to a woman suffering menopausal symptoms who had previously had a hysterectomy? A. Estrogen-only HRT, B. Combined estrogen and progesterone HRT, C. SSRI, or D. Gabapentin? The key here is that it's a woman who has already had a hysterectomy. The answer is estrogen only. Progesterone is not needed as the womb has been removed. So today we're going to be talking about the menopause. What is the menopause? The classifications and the physiology, the symptoms, risk factors and history, investigations and differential diagnosis, treatment, and then we're going to be going back over the questions we've just done just to see whether that's sunk in. So let's begin. What is the menopause? The menopause is a naturally occurring period in a woman's life when their menstrual periods and ovulatory function stops. The onset of the menopause starts with the cessation of menses for at least 12 consecutive months. This typically occurs between the ages of 49 and 52. What are the other classifications? Premature menopause. This is before the age of 40 years old and is considered premature. This may occur spontaneously or because of surgery, radiation of the pelvis, chemotherapy, autoimmune disease, Fragile X syndrome, or idiopathically. Premature ovarian insufficiency. This refers to amenorrhea, hypoestrogenic status, and elevated gonadotrophins due to a decline of ovarian function before the age of 40. Perimenopause. The transition from cyclic menstrual bleeding to a total cessation of menses may happen over several years. The duration is variable. Perimenopause is marked by menstrual irregularity and periods of amenorrhea due to declining progesterone and estradiol levels, and ends 12 months after the final menstrual period. Physiology. Women are born with a set number of oocytes, which become depleted during their early 40s. Fertility declines and ovarian production of progesterone, estradiol, and testosterone begins to decline. Before the menopause, FSH and LH levels start to rise due to altered folliculogenesis and reduced inhibin secretion. These biochemical changes in hormones are associated with the symptoms of menopause. Here you can see a chart which shows the different levels of hormones throughout the menopause years. So what are the symptoms and risk factors? Risk factors: age 40 to 60 years, have previously had cancer treatment, smoker, ovarian surgery. The symptoms: amenorrhea, irregular menstrual cycle, hot flushes and night sweats, vaginal dryness, itching, discharge and painful intercourse, decreased libido, mood changes, increased risk of fat fractures, and increased risk of cardiovascular disease. Let's take a look at her history and see if we can see some of the standout features. A 50-year-old school teacher presents complaining of night sweats and difficulty sleeping. She has also noticed a decrease in her libido and discomfort during intercourse. Her family complains that she is more irritable. She has not had a period for 12 months. Immediately prior to that, her periods were lighter and shorter. On pelvic examination, the labia minora appear thin and the vaginal mucosa is slightly pale. but the rest of the physical examination is unremarkable. Investigations. There aren't very many investigations, and normally the menopause is diagnosed clinically. However, you can do a pregnancy test if unsure, an FSH test, but this is recommended only in women under 40 to 45 years, as women over that age have variabilities in the levels FSH in their serum. This is considered elevated if it's greater than 30 litre. Serum estradiol. This is considered positive if there's less than 110 picomoles per litre. Differential diagnosis. Pregnancy. Amenorrhea with breast tenderness, nausea and enlarging abdomen. You can differentiate this by testing urine HCG levels, which will be greater than 25 IU per litre, positive for pregnancy. Polycystic ovarian syndrome. This will also be associated with symptoms such as hirsutism, acne, hair loss and irregular periods. The symptoms normally begin, however, at the time of puberty, and serum testosterone and DHEAS levels are elevated. Hypothyroidism, which is also associated with menstrual irregularity, hot flushes, tachycardia, tremor and hair loss. TSH levels may be suppressed at less than 0.01 IU per litre. Hypothyroidism is associated with heavy bleeding, oligomenorrhea, amenorrhea, fatigue, hair loss, dry skin, weight gain. TSH levels may be elevated at greater than 10 IU per litre. So what treatment can we offer? HRT or hormone replacement therapy. Combined HRT, which is estrogen and progesterone for women with menopausal symptoms who still have their womb. Estrogen only HRT for women who have had their womb removed in a hysterectomy. SSRI or SNRIs are effective for treating vasomotor symptoms in women unable to take hormone therapy. So in summary, let's go back over the questions we answered previously to see what we've learned. Question 1. During the perimenopause, the levels of LH do what? A. Rise, B. Fall, C. Stay the same. The answer is rise. Question 2. What age is the average menopausal age for women? Is it 48, 52, 49 or 51? The answer is D. 51. Question 3. What treatment would you give to a woman suffering menopausal symptoms who had previously had a hysterectomy? Estrogen only HRT, combined estrogen and progesterone HRT, SSRI, or gabapentin? The answer is estrogen only HRT. Thank you everyone, that's reached the end of the slideshow. I hope you found this useful and interesting. Please come back to Crash Course Medicine for more revision videos.